Hello, future healthcare heroes. Imagine this. You are in an OET speaking test, sitting across from the role play interlocutor. The clock is ticking, your heart's pounding, and bam! It's time to respond. Feeling nervous? Don't worry, because today I'm going to walk you through exactly how to ace the OET speaking test for doctors. By the end of this video, you will feel prepared, confident, and ready to shine. So let's jump in. So when we are talking about OET speaking test, the first thing is we are going to break down the task. So the OET speaking test is designed to assess your ability, how you are going to communicate effectively in a healthcare setting. So you are being evaluated on four key areas. The first one is relationship building skills. Can you connect with your patient and make them feel heard? And the second one is gathering information. So, are you asking the right question in order to understand the patient condition? So, that comes here. And providing information. Are you able to explain the medical terms clearly and in more patient friendly way? Structuring the conversation. So, are you keeping the conversation organized and easy to follow? So, these are the areas that you will be assessed on. Now, how do you master each of these skills? Here are my top strategies. The first strategy is try to greet the patient warmly. Try to use a friendly but yet a professional tone and show empathy. If the patient seems worried, try to acknowledge their feelings because this is pretty important, right? And try to maintain eye contact, like use open body language and try to listen actively to their concerns. Remember, empathy is key, correct? And always start with open ended questions. You can ask questions like, can you describe what symptoms you have been experiencing? Or how long have you been feeling this way? So instead of asking close ended questions like yes or no, always try to ask open ended question where you're inviting the patient to explain further and use follow up questions. So you can dig deeper in order to get the essential information. For example, you can ask like, have you noticed any changes in your routine since this started? This means you're looking further to this means you're looking further to get the essential information from the patient and paraphrase to confirm understanding. So try to summarize the responses. And in order to show that you're listening, you need to give it at the end or in between when you're speaking. You can just, tell them, oh, this is what you're feeling and this is what you're complaining. And these are the symptoms that you were undergoing. So all these things you can summarize and show that you are actively listening to them and simplify medical terms. So try to use patient friendly language instead of jargons. For example, instead of hypertension, you can say high blood pressure. Okay? And break the information into simple steps like don't overwhelm the patient. Explain things in bite sized pieces which could be consumed by them and regularly check for their understanding. So you can frequently ask questions like, does that make sense so far? Or would you like me to explain that again? Then reassure the patient. You can say things like, these are effective treatments available. Or you can say, like, you are not alone in this. So by saying these phrases, you are reassuring the patient. And start with a clear agenda. So you have to begin by saying, like, today we'll talk about your symptoms, discuss treatment options, and I'll answer any questions you may have. So you are starting with a proper agenda, what you're going to discuss for that moment. Use transition to stay organized. You can use phrases like, let's move on to, or now that we have discussed your symptoms, so let's talk about next steps. So these phrases or transition keeps your conversation flow in a very smoother way and always end on a positive note. You can summarize key points and you have to offer them like reassurance. For example, so if you follow these steps, I'm confident we can manage a condition well. And then you can invite the patient for further questions by asking, do you have any questions or concerns? Now, let's see an example. So, here is the scenario for the role play card. Patient Mr. Roberts, 45 years old, experiencing chest pain and feeling anxious about his condition. So, you can start by greeting the patient and showing empathy and assurance. Good afternoon, Mr. Robert. I'm Doctor. You can tell your name. I understand you're feeling some discomfort in your chest. That sounds quite concerning. I can imagine you may be feeling worried. Let's go through this step by step, and I'll do my best to help you feel better. So, here you're showing the empathy and reassuring the patient. Then you can ask open ended questions like, can you tell me more about when this started and how the pain feels? So here you are inviting the patient to explain his condition further. So here you are using open ended questions, right? Then, okay, so you have been feeling this since yesterday evening and it's a sharp pain that worsens when you move, right? Thank you for sharing that. Have you noticed any other symptoms like dizziness or shortness of breath? So here you are confirming the details, whatever the patient told so far, and also inviting the patient for further follow-up questions. Then, from what I have described, it sounds like this could be related to muscle strain, but I would like to conduct some tests to rule out anything serious. In the meantime, I will prescribe some medication to help manage the discomfort. Does that sound all right to you? Here, you are providing clear information and you're also checking for the patient's understanding. And later, you can say, like, please know that chest pain can have many causes and we are going to take good care of you. If you feel any changes or worsening symptoms, let me know immediately. Does that sound okay? Do you have any concerns before we proceed? So, here again, you are offering a reassurance and also you're summarizing what are the next steps that you're going to take, right? So now in this example, right, in this response, if you see, I could say this as a proper structured response. This is how your response also should be because here I have covered the key areas, which is relationship building, gathering information, and providing clear details, structuring the conversation. So this approach keeps you calm, organized, and ensures the patient feels heard. Got it? And here are some golden tips that you're going to nail your OET speaking test. First one, try to practice with role play cards regularly. The more scenarios you explore, the more confident you will feel. And use a mirror or record yourself. You can watch your body language so that you can refine your tone. The third important thing is time yourself. This is pretty important, right? So make sure your response fits within the 5 minute time frame for each role play. And try to stay calm. If you forget something, don't get panicked. Just pause, gather your thoughts, and continue in a natural way. Okay? All right, that's all for today. With these strategies, sample response, and tips, I hope you all are set to ace your OET speaking test like a pro. Remember, practice makes perfect, and you've got everything you need to succeed. If you found this helpful, don't forget to like, share, and subscribe for more tips. See you in the next video. Bye bye.